for having me today. I really appreciate it. And it's always great to be with others in the rare disease community and other advocates. So hopefully if you haven't advocated before, you will feel the urge and compelled to do so in the future. So I'm going to go through some slides for a little while, and then hopefully we'll have time at the end for questions. Marjorie, you want to move on to the next slide? Or can I move my own slides? Perfect. So this is a picture of our last Rare Disease Week that was in person. And that was in February of 2020, right before COVID hit. And we're hoping to be all back in person in 2022. Next slide. So I'm going to just discuss about the Every Life Foundation, rare disease legislative advocates, the power of patient advocacy, how you can get started being an advocate if you're not already, and then ways to get more involved in advocacy. Next slide. So the Every Life Foundation for Rare Diseases, that is the organization that I am with. I've been with Every Life for the last 3 years running the Rare Disease Legislative Advocates Program. And the Every Life Foundation, we are a nonprofit, nonpartisan organization that is pretty focused on policy and advocacy. So we're dedicated to empowering the rare disease patient community to advocate for science-driven legislation and policy that advances the equitable development of and access to treatments and cures. And we don't speak for patients. We really want to empower patients to use their voice. And so we just provide training, education, resources, and opportunities so that patients can be their own advocates. Next slide. So what we believe is that no disease is too rare to deserve treatment. Rare disease therapy should be safe and effective, and that we can actually do more with the science that we already have. Next slide. And so today, what I want to talk to you, these are our foundation policy goals and what we're working towards as an organization. But what I want to talk to you today is about our last goal, which is empowering patients. Next slide. So a little bit about rare disease legislative advocates. We educate patients on how legislation and policy impact them, build awareness on Capitol Hill, and ensure Congress hears directly from patients and caregivers. And then we really want to connect every member of Congress with a rare disease advocate so that when they're making important decisions, considering legislation and policy that impacts real people, they know it's not just about treating a disease, but it's about literally saving the life of a person that they've met, that they know. Next slide. And what we probably all of us here already know is that rare diseases aren't really all that rare, right? There's over 7,000 rare diseases, over 30 million people are affected. We did a national economic burden of rare disease study earlier this year that showed that the estimated prevalence of only 379 of the rare diseases was 15.5 million people. So there are probably a whole lot more than 30 million people that are affected by a rare disease. And of course, you all already know that the diagnostic odyssey can be very long. The average is 6 years. And that one of the results of our study was that patients saw an average number of 16, almost 17 specialists from the onset of their first symptom before they were actually diagnosed with their rare disease. So this has great impact on patients themselves as well as our society. Next slide. And those are really important things as an advocate to be sharing. But really quickly, I think that the AIDS movement is a powerful advocacy movement. It was really revolutionary at the time. They were chaining themselves to the FDA. These folks in the left-hand picture were outside the FDA telling them that their lives were going to be lost if the FDA didn't act quickly enough. Next slide. And it really showed that patient advocates really are the best advocates, much better than lobbyists themselves. From the AIDS movement, so many things happened to help accelerate the development and approval of drugs, in particular for HIV and AIDS, but for many more drugs. And it really, because of that advocacy, we saw the biggest surge ever in innovation. Next slide. And so the most important lesson is that educated and activated patients are far greater at making change. Next slide. So what do you do as an advocate? You can advocate for yourself, a loved one, a community. You can advocate to educate your lawmakers on what it's like to live with a rare disease, or to be a family member of someone with a rare disease, or you can ask them to solve a problem. And you can advocate because legislation and public policy impact healthcare for you and your loved ones. Next slide. So you have the power to affect change. Really, that's the power of grassroots advocacy, is that you do have this power. You can take an active role in the political process to make real change for not only yourself, but others in your community. You can influence legislation and policy, speaking up when you see policies that might impact you, or when you want your legislators to make certain decisions, to co-sponsor a bill or to vote a certain way. And telling your story is really an impactful way to be an advocate and to influence the political process. So you just keep in mind that you are your best advocate, and that you do have the power to affect change. Next slide. And so I know that we can be a little bit disgruntled by our elected officials, especially those in DC, and feel like they're really far away and not really listening to us. But I think it's so important to keep these two things in mind, that you are the constituent. They represent you, and they're going to want your vote when it comes to election time. That is part of the deal. And you're the expert on your rare disease and experience. So never feel like they don't want to hear from you, or that what you have to say isn't important. You are the expert on your experience and what it's like to live with a rare disease. So you should feel like that's important to your member of Congress, and make sure to share that with them. Next slide. So these relationships matter. This is a survey that was done by the Congressional Management Foundation that showed that those in-person visits from constituents really were the most impactful on legislators, much more so than other actions. Next slide. And I like to think of Zoom meetings as the pandemic equivalent of in-person meetings. So while we're still in this world, Zoom meetings kind of are the equivalent. And then I just like to show this, this is kind of how a bill becomes a law, but it kind of shows all the different steps in which you can be an advocate, where your voice can make a difference. So there are so many opportunities to advocate throughout this whole process. So just keep that in mind. Next slide. So how do you advocate? So in advocacy, the number one thing is you want to create relationships, whether it's a state or a federal issue, creating those relationships with your state or federal legislators, and then sharing your story along with an ask. You always want to have an ask, something that they can do for you to help you. So keep that in mind when you're talking to them, being specific on what that ask is. And then stay engaged with them. Asking questions can be a great way to just stay engaged, stay on their radar. And then of course you can engage with other organizations who support you and support others with their policy goal. And then activate your own network, your friends, your families. If you're gonna take action on something, you should ask your friends and families to do that too. It's a great way for them to support you. And sometimes advocacy can be as easy as entering in your address and clicking send on an email. Next slide. And so how do you get started? First, you want to determine what your goal is. So you might not have a specific policy goal in mind when you first get started. It might be just about, building those relationships and building awareness and education about the problems that you face, about your disease, about the treatments that you need. And then if you do have a specific problem that you need solved, that would be your goal, right? Is getting insurance coverage for your treatment, getting an FDA approved treatment, needing a diagnosis, funding for research. So determining what that goal is and what you want them to help you solve is your first step. Next slide. And then to get started, you want to engage with your legislators. So if it's a state issue, you're going to talk to your governor, your state legislators. If it's a federal issue, you're going to talk to your representative and your 2 senators. And then as you get more and more advanced, and if you're working on specific goals, you'll start wanting to meet with the committee of jurisdiction or leadership or certain government agencies. And you just keep in mind that the staff, many times we meet with staff are an amazing resource in some ways, getting them to support you and whatever your goal is can be even more impactful than the legislator themselves. Next slide. And to get started, really there's no bad time to get started. You want to start advocating anytime, all the time. I always say, don't wait until it's too late. The worst thing that could happen is for a bill to pass and become law and feel like your voice wasn't heard, or that it doesn't really help and serve you or your community. So just make sure to be vocal early about those issues that you really care about. Next slide. And so this is just, there's so many different ways to be an advocate, and the most important thing is to make it personal. But I would say too that we all have so many different talents. If your talent is writing, then you might want to write an op-ed or a blog about an issue. Or if you're really great at social media, then social media is such a great outlet for advocacy. So it doesn't have to be meeting in DC with your legislator. It could be just picking up the phone and making a call. So there's so many different tactics to it. And you should start with what feels right, what feels comfortable, and just keep making it personal. And then you're gonna have to, I think that there's extra puzzle pieces here. If you could just run through them to the next slide. Yeah, just keep going. Perfect. And so social media is an amazing advocacy tool. So use it for your benefit. You can tag your members of Congress in your posts with photos that you've taken with them, or of yourself or your loved one with a rare disease, and make them aware of the problems you face. Ask them to take action. Thank them for the actions that they're taking. If you do meet with them, thank them on social media. Many members of Congress, legislators, are paying attention to their social media, and if they're not, they have a staff person like a press secretary who certainly is. Next slide. And so one thing is that advocacy means being persistent and staying persistent. So you can't just take that one action and feel like, you're done, wipe your hands clean. It really does take persistence. So when you do take an action, follow up with them to see, did they co-sponsor that bill you asked them to co-sponsor? If you meet with them, follow up with them, thank them for the meeting, and then just continue to remain engaged. And there's so many different ways to do that. You can sign up for their newsletter to see what they're up to, friend them on social media, look for more opportunities to meet with them, their town halls. My city council member does these monthly coffees that you can go to at a coffee shop. It's a great way to just have a chat in a low stress environment. And then stay in touch with the staff that you meet with. If you have a phone call conversation with them or meet with them in person, touch base with them every once in a while and see what's happening in the area that you care about. Next slide. So if you're interested in advocating, Rare Disease Legislative Advocates has many different opportunities for you to advocate or learn more about advocacy. We have monthly webinars and free events, as well as action alerts and a monthly newsletter. So you can find out more at rareadvocates.org if you're interested. Next slide. And if you're ready to jump into advocacy, we have a few different ways that you all can join us. The first, next slide, is Rare Disease Week on Capitol Hill is actually coming up, and it will be virtual this summer, but our deadline to register is June 18th. It's going to take place July 14th to 22nd, and you can register at rareadvocates.org/RDW. Next slide. I guess that deadline is today too. It's crept up on me fast. So it's new dates, new format, going virtual, but it's that same life-changing experience. We're bringing everything that would normally happen during Rare Disease Week in person here in DC to the virtual space. So it's going to be our documentary screening, our Rare Disease Caucus briefing, our legislative conference, as well as meeting virtually with your members of Congress and or their staff. And so we actually schedule those meetings for you, put together your schedule, send it to you, and you meet with your members of Congress, your representative, your senators virtually, just like this. And you do it with other rare disease advocates who have also signed up from your state or district. So it's a great way to not only meet your members of Congress or their staff, but also meet other rare disease advocates too. Next slide. We can skip this slide as well. And one of the new events for this year is our diversity roundtables. So on Thursday, July 22nd, as part of Rare Disease Week, we're going to have a series of roundtable discussions for patient advocates, industry leaders, and other stakeholders in the community to have conversations about the barriers to care for underserved rare disease communities and the solutions that can make a difference. So I hope you all can join us, or perhaps some folks from your organization. Next slide. And you can register for that as one of the events during Rare Disease Week. And so one of the fun things we're doing with Rare Disease Week this year, we normally would provide folks with travel stipends to come to DC, but since we're virtual, we are actually since it's virtual, we're going to make give opportunities for the advocates to earn points throughout the week by taking certain actions, by attending some of the events and sessions, and the top 50 point earners will win $1,000 to $5,000 grant for their organization of choice. So the Every Life Foundation will be making those donations after Rare Disease Week, totaling $100,000. So this is a great way to also get some money to organizations that you care about. Next slide. You can go ahead and go to the next slide. And then one other quickly, Rare Across America usually takes place in August. Since we're doing Rare Disease Week in July this year, we won't do Rare Across America for another year in August of 2022. But this is an opportunity for you to meet in person with your senators and representative in their in-district offices, so close to where you live, so you don't have to come to Washington, D.C. to meet with them. And so keep your eyes out for more information on that. And if you're interested in learning more about it, you can at rareacrossamerica.org. Next slide. And then for our young adults, if you're a young adult or have young adults in your family who are interested in advocacy, we have a great program called the Young Adult Representatives of RDLA, and that is for 16 to 30-year-olds, young adults who are interested in advocacy, networking, getting more involved. We have a speakers bureau, so if they want to learn how to become better public speakers and tell their story in different ways, this is a great opportunity, and you can learn more at hearser.org. Next slide. And so it's been so nice to be here with you all today. If you do have any questions, I think we might still have time for questions if you do, but if something pops into your head, we're here to support you. So please do not hesitate to reach out to me or my colleagues. Here's our email addresses. And then if you're interested in learning more, you can check out our website, rareadvocates.org, or follow us on social media. So we have different Facebook and Twitter accounts for the Every Life organization and RDLA. So feel free to check them out if you're interested. All right, did we want to do some questions, or how much time do we have? Oh, I think you're muted.
Has any questions, put them in the chat. I'll be more than happy to read them out to our lovely speaker.
Okay, great.
Hi, thank you so much, Shannon, for sharing.
Thank you.
I just wanted to say that Rare Disease Week on Capitol Hill is what got me interested in legislative advocacy and taught me. So I'm really thankful for this opportunity of you joining us today. I want to definitely share that it was a great experience learning years ago, and I brought it back to the community, and our whole community kind of joined in. So I'm so happy that we have this opportunity here to have you and have you explain about legislative advocacy and how we can get involved. And as you said, today's the deadline for Rare Disease Week. So I thank you so much for that.
Thank you. I love that you came to Rare Disease Week and brought it back to your community. That's amazing. And I do hope that we're back to Rare Disease Week in person in February 2022. I don't want to jinx it, but I think we are headed in that direction. And just, if you are interested in coming to DC for that, I would just point out that we do offer travel stipends to some of our community members to come. So that application usually opens in October. So just keep an eye out for information on that, because that's a great opportunity to get some help with the travel costs to come to Rare Disease Week in DC. So hopefully you guys will be able to come to DC at some point soon.
Thank you so much. I appreciate it so much for you coming and sharing that. I'll leave that now to Marjorie and Denise.
Yes, thank you so much, Shannon. We so appreciate you. Thank you for just speaking with us today.
Thank you. Have a great day.
Thank you. Were there any more questions?
There weren't any questions, any more questions at this time.
Thank you so much. Thank you.
Great.
We will move on to our next session. I thank you all for joining this session, and thank you so much, Shannon Feldon, for all your hard work and information that you provide. We'll continue to advocate and jump in and do the best that we can to definitely support our rare disease community, because we're strength in numbers. I say it all the time, we're strength in numbers. So thank you so much. I appreciate you so much.
Thank you. Thank you. Have a good one.
Bye.